Hello everybody, welcome. I'm very pleased to be celebrating the 20th anniversary of our behavioral health program. And I'm pleased to introduce these two very instrumental members of our team over the years. And I'm proud to be able to say that they became friends through the course of our working together very closely to initiate the program and then grow it to what it is today. And so with that, I'd like to introduce Jeff Ryder and Jim Burgess to speak a little bit about what behavioral health means at HealthPoint, what the primary care behavioral health model is, and how that grew over time and how they helped to initiate the program.
One of the things that started happening pretty quickly after Jim and I started up the PCBH service is that it started to grow, and there was just such a need for more behavioral health help in all the clinics. And it became quickly apparent to both Jim and me that it was hard to find people to do this work because at that time it was pretty rare for graduate programs in social work or psychology or any kind of counseling program to train people in primary care in any way, shape, or form. One of the nice things about Seattle is there are a few different programs in Seattle, universities that train behavioral health providers. So we just started talking about, wouldn't it be nice and helpful if we could team up with these schools and develop kind of a pipeline where we could train graduate students to work in primary care. Hopefully the exposure that they have to it would excite them about it, get them to love it as much as we loved it.
Initially, we were on kind of a shoestring budget, so we didn't have funding to be able to hire behavioral health, but we knew there was a need in all of the clinics. The student program was really helpful at kind of training people, but also allowing to get some services into the clinics where we didn't have a paid behavioral health consultant, so they could get experience. The hope was that it would be a pipeline that we would ultimately be able to hire people to fill positions at those clinics.
We were just so fortunate to have such great students, like Jim was saying, that they really won over the PCPs. And, it did take a little time, but they started to see after a while that in fact they can really trust these students to provide great care to their patients. In the early days, really nobody knew what integrated primary care was. If you talk to psychology or social work graduate training programs, but now they pretty much all know what it is and often have a lot of interest in it. I think one of the most gratifying things too, from my standpoint, is just that pipeline that we originally hoped to create, where we brought people in, trained them, and then ultimately hired them to work at HealthPoint, has worked. I mean, we've hired some amazing BHCs at HealthPoint that have stayed there for so long and just given so much to the HealthPoint community. We've had a lot of great graduates who have gone on to really do wonderful things in the integrated care field.
I didn't think HealthPoint was going to grow as much as it's grown in the last, 20 years, expanding with the school programs and all the other programs that they're doing.
It's been wonderful to see that as HealthPoint has grown, the behavioral health program has grown with it, and it hasn't been left behind or forgotten. Success breeds success. As successful as HealthPoint has been so far, it's going to grow even more. It's going to be even more successful in the future because of all the good people who are there. And that's going to make the work even more wonderful, but also more challenging, in a lot of ways. And just the ripple effect from creating that training program is huge. And you think about how many hundreds of thousands of patients must have been helped at this point by, all of these folks. It's really cool to think about.
Thank you, Jeff and Jim. Thanks for sharing about the program. You and I went through a lot in those early days of the program. Look what it's become today. You've just spoken to that, and we are so proud at HealthPoint of all of our learners and all of our behavioral health consultants that help make this program thrive. Thank you.